Alright, so now I have the SI provocation test. So the first one I'm going to do is straight leg raise. So the first one is going to be the active one. So go ahead and can you please raise your right leg up? Good. Is that as high as you can go? And go back down. Good. Now can you do that on the other side? And back down. Alright, so how was that? Does it seem okay? Not too difficult? Right leg was more difficult? Okay, go ahead and raise that up one more time. And back down. So what I'm going to do is I'm going to add an anterior compression. So go ahead and lift your right leg up again one more time. And back down. How was that? Was that easier, harder? Easier. So if it was easier, then I would say that she has decreased transverse abdominis strength, and that's one of the things we'd be focusing on. Meaning that if it was activated more, then her leg raise wouldn't be as difficult. I'm now providing that compression and that pelvic stability, acting as the corset or the transverse abdominis to allow an easier leg raise. If then that wasn't an issue, I would then go back here and I would provide compression at the posterior part of the pelvis and go ahead and lift up. And then down. And if that was easier, I would think it's more of a multifidus issue rather than a transverse abdominis issue. So that portion involves the active straight leg raise. Next we have the passive straight leg raise. So I'm going to go ahead and just lift your leg up. Alright. And then while I'm doing this, you don't have to go that high, but I can just get a sense for maybe her hamstring length. But if she had a disc issue, there would be pain. Did you have any pain with that? There would be pain within the first 30 degrees of range of motion. Say she was positive. This is only a sensitive test. So if she was negative, it would indicate that she most likely does not have a disc issue because it has a high sensitivity. If she's positive, I would go ahead over here and check the left leg. So I'd say, okay, I'm going to go ahead, relax your leg, I'm going to raise it for you. Okay, do you feel pain? She'd say yes, I'd say where, and it would be whatever pain that she came in with that provoked it in the first place, it would be those similar symptoms. So if she was positive on this right leg and then positive on the left leg, then this test then becomes specific because it occurred on the contralateral leg. So this is most likely indicative of disc herniation or disc issue. So that's the active and passive straight leg raise. So the next ones on the list are the internal and external rotation, which we did in the previous video, but you're basically looking for internal, external rotation of the hip. You're going to do it in the plane here, supine with leg extended, and then you also want to do it at 90. But like I said, we already did that, so we're going to skip that for time's sake. The next one is SI versus lumbar flexion in supine. We looked everywhere in like your study guides and in the book and stuff and online, and honestly, we don't really understand what you mean by this one. So I'm just going to clinically, as a clinician, just give you my best shot. So what I'm looking for here is I'm just going to do some flexion of the spine. So I'm going to do one leg like this. Okay. Just kind of get a feel for movement. I could also go ahead and hold on to the ASIS. See if I feel that moving. Which I do feel movement under my thumb. Go ahead, go over to this side, same thing. Now the ASIS should be moving superiorly as the PSIS is going to move, inferiorly. And then just to get both of them at the same time, get a kind of feel for that. can do some flexion this way. Now to kind of differentiate between the two, I could place my hand as well behind here on, can you roll over that way a little bit? Okay. On PSIS, and I can just roll off of PSIS and get into the SI joint and just feel for movement this way too. Another way too, you could check for flexion. You could palpate the coccyx as well and look at the amount of flexion that occurs with the coccyx. Okay, so posterior shear, which is also thigh thrust. What I'm going to do here is I'm going to flex the hip to 90. I am going to adduct just a little bit, and then I'm going to provide a posterior force to allow the pelvis and sacrum to shear against one another. As I apply that compression, I can even give a little spring at the end and then see if that provoked any of her pain. If it did, that would be positive. The next one is Faber. So this is going to be flexion, abduction, and external rotation. So I'm going to apply just a little bit of force here, stabilize this side just to make sure that her hip doesn't come up, and just apply a slow force. You gotta watch out for any tightness as it is. She looks pretty tight just putting her legs in this position, so that could just be some muscular restrictions. But if I were to press down and I ask the patient if they have any pain, do you have any pain? In the front. So she might be having a labral issue. That is not what we're looking for. That would be a different test. So we are looking more for her original symptoms that she came in for, or anywhere in the SI region. So this would be a negative test for her. Next would be the hip scour test. Got me in lab with this one. So, redemption. I would flex the hip up to 90 degrees. And what I want to do here is I want to make sure that I'm getting the complete acetabulum. So first what I'm going to do is I'm going to apply a compressive force through the femur. And I'm going to go in a huge... Ooh, you're tight. You okay? I'm not going to apply that much of a compressive force because it's already a little painful for her. But I'll just show you the motion that I'm going through. So then I go the other way as well. You okay? And then I'd want to do a little bit smaller circles, make sure I'm getting in the inner portion of the acetabulum. You go the opposite way. And then just in case I missed any of that. Just try not to fail again. Alright, so that would be the hip scour test. And pain in the SI joint or whatever symptom, reproduction she had that she initially came in for would indicate a positive test. So the next one is resisted isometric adduction and abduction. So can you go ahead and put your feet flat on the table for me, please? And I want you to go ahead and squeeze into my hand. Squeeze, 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 squeeze. And relax. Okay? Now go ahead and squeeze into my hands. So push out. Good. Any pain with either of those? No? Okay, so positive reproduction of symptoms would be a positive test for that one. Next I'm going to do compression and distraction of the SI joint. So first I am going to do compression. So I'm going to go ahead and place my hands right here on your hip, okay? And I'm just going to give it a little bit of a force, and you're supposed to hold for 10 seconds, give a little spring at the end, and then ask for pain. So, ready, and go. So Do that for 10 seconds and then apply a little spring at the end. How's that? Any pain? You want to let them know that the ASIS can be very uncomfortable, so if they do have pain, just make sure it's not originating from the ASIS and it's reproducing their pain or SI pain. The next one I'm going to do is, so the compression, I'm going to do distraction. So same thing. I'm going to press down and out, so it might be a little uncomfortable. Ready? And a spring. Any pain there? Okay, good. Same thing for compression and distraction for positives there. Stork test. So you can do this in supine or sitting. Nope. You can do this in standing or sitting. I wrote that down wrong. And let's go ahead and do it in sitting first. You can face the front, or yeah. I just didn't want both of our backs. I'm going to be blocking it. Alright. So I'm going to palpate the iliac crest and then find the PSIS. Oops, sorry. I'm going to tuck in her shirt. So I have them palpated. Right now, they seem equal to me. So I'm going to say, go ahead and lift your right leg up. Okay, and back down. And then right leg. Left leg. No, right leg again. Okay. Now go ahead and, so there I felt the PSIS on the right side move downwards. Now I'm going to check the left side. Go ahead and lift up. And down. And then up and down. So same thing, on the left side I felt it go down, and actually I felt the right side shift upward a little bit too. So it was almost like a counter rotation going on that last one. So here what you're looking for is you want that movement. If for some reason an individual lifted their leg and that did not move, there's some other type of compensation occurring in the body that is taking over for that movement, and that means that the pelvis might be hypomobile and stuck or locked in place. The next one, this is the one that you would most likely do for pregnant women. You'd rather have them do it in sitting, it's just a little bit easier, but you can also do it in standing, but that's more of like the Gillette marching one that we did. The next one is going to be the forward bending. So first, since she's already sitting, I'm just going to have her doing it in sitting. Basically, I'm doing the same thing. I'm palpating the PSIS, and I'm going to have you go ahead and bend forward for me, slowly. Alright, and back up. And what you're feeling for here is movement. You're feeling for equal movement on both sides, and you should be able to feel it right away. So movement's going to start occurring naturally within the first few degrees, say like 5 to 10 degrees. So you don't have to make them go until they're about to fall over to the floor, but you just want to get a feel for that movement. So go ahead and do that one more time for me as I'm feeling it. They seem as if they're moving in sync together, and then back up. So you can also, oh, my knee just popped. You can also do that in standing. So go ahead and stand for me, face that way. And you can do a bunch of different directions, because it's not always going to be flexion that's an issue. You could have them backward bend, side bend, rotate, and just get a feel. But for this case, I'm just going to have her go just forward bend. So go ahead. All right, and back up. All right, and same exact findings that I found in sitting. So the last one is going to be the long sit. So for this one, I'm going to have you go ahead and lay down for me. So here I'm checking for leg length discrepancies. So first thing I'm going to do is put her legs down like this. I'm just going to like realign her body. Yeah. Realign her body, and then go ahead and bend your legs up for me. Good. And now can you just slowly lift your bottom off the table? Good. And go back down. So this is just going to kind of reset her pelvis and just reset maybe the way she's positioned on the table in case she was malaligned. Just to check before we start this test. So what I'm going to do is I'm going to extend her legs, palpate the medial malleoli, make a mark on there, and then bring her ankles together, which they do not go together, so that's not going to work. But I'm just going to get kind of eyeball and see how that is. Next thing I'm going to do is bring the legs up. Wait, no, I'm not. Next thing I'm going to do is go ahead and just have her sit up and see if there's a change. So they both look equal. So that means that there's most likely not a leg length discrepancy. However, say, for example, she was longer on her left side. So she's longer, and then she goes to sit up, and that leg becomes equal or shorter. So that would mean that she would have an anterior rotated pelvis because it went shorter when she went from sitting. Yeah. All right. So that concludes all of our tests for provocation.